Hi, I'm Dr. Mark Jackson from Carolina Vein Care. One of the questions we get most commonly are, what are the symptoms of varicose veins? What should I look for to know I have varicose veins? Well, first of all, the obvious thing is the appearance. One can just look at their legs and almost always there's significant visible evidence that varicose veins are present. The leg veins, instead of being practically not noticeable or even visible, instead dilate, they become lumpy and bumpy and almost look like little blue grapes under the skin. In more subtle presentations, you might find what are called spider veins, where you get a little web or spider web looking appearance of a cluster of tiny small veins that are maybe only a millimeter or so in diameter, but they occur in clusters and often look like bruises or patches of these small veins that are clustered on the skin. And that's another appearance issue that we will deal with commonly. In addition to the appearance, there are a lot of symptoms that can occur after someone has developed varicose veins, usually after a few years. And those symptoms include swelling, particularly around the ankles and lower legs, achiness and heaviness, also more commonly below the knee than above the knees, and just a feeling of achiness, tiredness, itching. Those are all common symptoms that we see with varicose veins. Varicose veins, almost by definition, appear in the lower extremities, the legs, the thighs, and those are where the veins predominantly are that have the malfunctioning valves. And the veins that we see basically are little branches that come off of those veins that have the malfunctioning valves. You can almost think of it as that the vein that has the bad valves is the trunk of the tree, and the branches of the tree are the veins that come off of that and are lumpy and bumpy and appear all along the thigh and the inside of the thigh and legs. Those are the most common locations for the varicose veins.